What they're doing today, what they're doing this week, is abandoning and betraying fundamental American principles, and the American people won't stand for it.
Congressman Price joins me now from Capitol Hill. It's good to see you today.
Hey, Contessa, great to be with you. Thank you.
Do you believe that health care is the right of every American?
I believe that we're a compassionate nation and that we can figure out how to make certain that every single American has access to health coverage and health care without putting the government in charge. And that's the key. That's the fundamental break that we have with the Democrats who are in charge right now. They believe the federal government ought to be making decisions. We believe it ought to be patients and families and doctors.
Do you believe the current system gives American that access you believe they have the right to have? The current system?
There's access, but it's not access that provides the highest quality care in the most efficient manner. That's why we believe through H.R. 3400 and other pieces of legislation that we can get individuals covered with the kind of health care coverage that they want for themselves and their family, not that the government demands or dictates to them. And that really is the key, Contessa. So we're at a fundamental divide in our nation right now. Who's going to be making these decisions? Is it going to be the federal government, or is it going to be patients and families and doctors? We come down on the side of patients and families and doctors.
Let me put up the plan that you endorse on your website, this Empowering Patients First Act. You say, yes, there should be access to coverage for all, that there should be the ability to carry your insurance. If you lose your job, if you move to another state, you should be able to keep your insurance with you, that you should improve health care delivery structure and rein in out-of-control costs. I just want to say the basic bullet points there mirror what the Democrats say they want to do as well. But when we're talking about reining in out-of-control costs, you are a doctor. How do you do that?
Well, Gallup came out with a study 2 weeks ago that said that $1 out of every four, 25% of the health care costs, $650 billion a year, comes from the practice of defensive medicine. And the Senate bill, the Democrat bill, does nothing to end the practice of defensive medicine. H.R. 3400 would address that issue and free up $650 billion a year. I don't know why we wouldn't want to do that in a very positive way that then allows us to do the other things like making certain that individuals have access to the kind of health care coverage, again, that they want.
Okay, so I'm confused because Gallup is a polling organization. The studies that I've done by people who study health care say that really tort reform, which is what when you're talking about practicing defensive medicine, it's about doctors trying to avoid, and correct me if I'm wrong, but trying to avoid lawsuits. So the studies that I've seen show that that's no more than 2% of the overall health care spending.
Actually, they vary somewhere between 2%, and Gallup's was the most generous at 25%. As a practicing physician, having cared for tens of thousands of patients and talking to my colleagues, I know that it's more than 2%. I estimated it to be 10%. But even if it's just 10%, that's $270 billion a year that we are not addressing in the Senate bill. That's the largest amount of money that we could get.
That's always the fall to argument that Republicans make when they come on with me, is they're talking about tort reform. I really don't get how that reins in these I mean, if you have an insurance company raising premiums 50%, reform alone addresses that.
Well, if we allow individuals to actually get the coverage that they want for themselves and for their families, not that the government wants for them, and not that has government price fixing, then actually you get a system that works, that has resulted in the greatest nation in the history of the world, and that is through the marketplace. You got to make certain that folks have an opportunity to purchase the coverage that they want, but then you got to get out of the way, because what Senator Reid and Speaker Pelosi believe is the right health coverage for you may not be the right health coverage for you. It may be something completely different. And you ought to have the right as a free American to select that kind of coverage that you want for yourself and for your family, not that the government wants for you.
Congressman, it's good of you to join us today. I appreciate your stand on this and your explanation.